these changes are huge and sweeping, and I think we're still grappling with the impacts and who's affected and how this is going to affect the industry. And the industry is grappling with that right now too. I mean, we are still, like, information is trickling in still as we're trying to figure out which divisions are being, cut, who's being laid off, exactly what it is being impacted. And so that's something that's like, information is still actively coming in.
What's the relationship, Madison, with the government, public health, people who work in the government, and then the private sector and the development of drugs that ultimately get put into the pipeline and approved years later? What do we know about that relationship and how one affects the other?
I mean, they're critical. They work together in research, in drug approvals, drug development. Like, the government is so important in all of that. Obviously, the FDA, the U.S. Food and Drug Administration, is viewed as sort of the gold standard regulatory agency for approving medications in the world.
Wow.
And a lot of other countries look to the FDA. The FDA is usually the first to approve drugs. Americans are typically the first to get access to new innovative medications. It happens more quickly here. And so I think, other countries, other regulators are also looking at what's happening in the FDA, in the U.S. and at the FDA, and thinking, how does this impact us as well? We have companies this week that are, have PDUFA dates that are expecting drug approvals. And
what's a PDUFA date?
That is a sort of an expected drug approval window, and Sam could probably speak to this more, but we sort of use that to gauge when drug approvals are going to happen. We'll see what happens with those. It's kind of all up in the air right now.
It's just this stuff that we just take for granted, right? That it's just going to work because it's just the world that we've lived in, grown up in, and seen for multiple generations. Sam, I thought about when we were going to have this conversation with the two of you, how many times throughout COVID we reached out to you, and I would listen to you early in the morning, with either our surveillance team or other teams. But like, how are you thinking about what you're seeing happen in government and what it might mean for us in terms of healthcare in the United States?
Ooh, how long do you have?
We got a little bit of time. This is radio. We can hang. We can hang.
But I am thinking, these things that we take for granted.
HHS, the Health and Human Services, which is run by RFK Jr., it runs quite a lot of these important institutions, or at least decides their budget, etc. So the CMS, Centers for Medicare Services, so that includes Medicaid, Medicare.
Right.
And Madison, step in anytime you fancy, right?
Yeah.
You've got the FDA, which we've just been talking about, and you've also got the CDC, etc. So pretty much the health of the nation is in the hands of this institution. And they have to decide whether they want to continue to support vaccinations and be, for example, very positive about saying you got to go and get your vaccines, and not say, but it's a personal choice. Because vaccines don't save lives. I've said that this morning also. Vaccinations save lives. You got to get it in the arms. If only 80% of people take it. Remember herd immunity and all that?
Yeah, totally.
For measles, that's critical, which is why you're seeing these pockets.
Sam, you're here visiting us in New York, which we love. You're usually in London. You spend a lot of time in France. You have this global view. As Madison said, the FDA is the gold standard for approvals. Does the world have to look somewhere else? Does it have to look to the NHS? Does it have to look to another regulatory body now?
I think I'll come back to you with the word uncertainty. I don't know. I don't think so.
I mean, is there an institution out there that is akin to...
The European Medicines Agency, the MHRA in the UK, they are all great. MHRA is one that does its own assessments. The Europeans tend to, or at least, and maybe the UK also tend to rely on the depth of work that the FDA does. The FDA rolls up its sleeves and looks at raw data and makes its own analysis. Then the companies present.
That is so interesting. So come on back in, Madison. Like, I do think about collaboration, right, on a global scale.
Right.
What typically happens? I mean, again, these are things that I don't think anybody ever thinks about, but I'm assuming that there is data sharing, especially when it comes to important medications and so on.
Yeah, and I mean, even with vaccines, like you were talking about, we've seen some back and forth of there are global regulators and health experts that meet to decide on what the flu vaccines will be for the season. And we saw some pullback with the U.S. deciding whether or not to attend this meeting, which has happened, every season for I don't know how many years, a long time.
Decades.
And so, decades. And so it's there is so much collaboration that goes into it, and whether or not the U.S. is going to be participating in that going forward is a question right now, because we don't even know who's left at the agencies, quite frankly, at this point.